everyone, welcome to the Newbie Doctors, your one-stop place for health information, health tips, study tips, and of course sharing of our medical experiences. In today's video, we're going to be discussing an overview of the congenital heart defects. And if you remember from my last video where we spoke about the heart, I said congenital heart defects are one of the common heart pathologies that are easily found today in the hospital. So guys, let's go right into today's lecture. Today we're going to be looking at a brief introduction into what congenital heart defects are. We're going to be looking at the classification of congenital heart defects. We're going to be discussing the different types of congenital heart defects and some brief definitions of these types of congenital heart defects. We're also going to be discussing signs and symptoms of congenital heart defects as well as diagnosis and treatment of congenital heart defects. So what is congenital heart defects? Congenital heart defects is an abnormality that develops in the heart before birth. It is one of the most common types of birth defects. These heart defects can be due to various reasons. We could see different reasons as to why a baby might have a congenital heart defect, and it could be due to defects in the gene or chromosome, like for example, in the presence of Down syndrome, in the presence of Edwards syndrome, Septal syndrome. All these chromosomal defects could also cause congenital heart defects. Also, it could be due to environmental factors. It could also be due to the mother's health condition. For example, in case of gestational diabetes, where the mother has diabetes from the early stages of the pregnancy, especially in the early stages of the pregnancy. And here we're looking at the first trimester, the first month, the second month, the third month. If there is a case where the mother develops such a condition, it could lead to the child having congenital heart defects. And also the kind of diet that is observed by the mother during pregnancy and medications used during pregnancy. Sometimes we also have a case of hypertension during pregnancy or due to pregnancy, and in this case the mother has to take some drugs, and if drugs such as ACE inhibitors or statins are used, it could actually cause a defect to the heart of the child. And also, it could be due to cases of infections like presence of rubella or other viral infections as well. Also, these defects can be located in the heart valves, in the walls of the heart, or in the blood vessels. Here we have the classification of congenital cardiac defects. I know that this table might look a bit bogus to us, but I'm going to try to break it down for us. So we have, first of all, the first table where we speak of the stenotic cardiac defects. The stenotic cardiac defects are basically due to the narrowing of valves or of vessels that pass blood through the body, and that is what causes this congenital heart defect. And for the stenotic kind of cardiac defects, we could see aortic stenosis, which occurs in the aortic valve. You could see pulmonary stenosis and also coarctation of the aorta. And now we have the shunting types of cardiac defects. Normally we know that we have the left heart and the right heart. So depending on the movements of blood from the left to the right or from the right to the left, we have shunting cardiac defects as well. So in a case where the blood is shunting from the right to the left, we could see cases like tetralogy of Fallot, we could see transposition of the great arteries, we could also see tricuspid atresia, and also in case of blood shunting from the left to the right side of the heart, we could see patent ductus arteriosus, there could be ventricular septal defects and also atrial septal defects. And also in the case of shunting, we have cases whereby the blood comes to mix in one point. I'll be explaining later on why this could happen, and we would see here, we could see truncus arteriosus. We could also see the total anomalous pulmonary venous return, which is TAPVR for short, and also we could see the HLHS, which is hypoplastic left heart syndrome. I will further go on to discuss this later, so don't be worried about the names or not understanding what they are about. I'm just letting us know briefly what causes these types of cardiac defects. And now also, according to types, we could also see cyanotic and acyanotic cardiac defects. And what do I mean by cyanotic and acyanotic heart defects? By the name cyanotic, we know that this means less oxygen, and as I put here, we said right to left shunt. So this is usually seen in right to left shunt. And what do I mean by right to left shunt? Usually we know that the right part of the heart, or should I say the right heart, contains oxygen poor blood. So usually in case of right to left shunts, the oxygen poor blood is supposed to go through the lungs to get oxygenated before it goes to the left side of the heart. But in case of the right to the left shunts, the blood bypasses the lungs and goes directly to the left part. So that means that the oxygen poor blood is carried to the right heart and then it is taken round the body. And we know what happens when oxygen poor blood is passed around the body. Cyanosis occurs because the body is not getting enough oxygenated blood. It's getting blood, but this blood is not oxygenated. So that is why we have the cyanotic congenital heart defects. And then we have the acyanotic congenital heart defects. Usually it is asymptomatic, but I'll be explaining why it would also be a problem. Here we have it is the left to the right shunts, and for the left to the right shunts, what we see here is that we know that oxygen rich blood is in the left part of the heart and it is supposed to flow directly to the body. But in this case, while a part of this blood goes to the body, some part also return back to the right heart where the oxygen poor blood is. Then they go back to the lungs, repeating the cycle. So some blood is going to the body, but it's not enough to sustain the body. So the body is getting blood quite alright, and it is getting oxygenated blood, but much volume of that is also going back to the right heart where of the oxygenated blood, which is the oxygen poor blood, is. So that is why it could also cause a heart defect, because yes, the body is getting blood, but it's not getting enough blood as it should. Now we have the main types of congenital heart defects, and I describe them as the main types because out of all the types, in 10 people, you will be bound to find 7 people that have this type before you found them having the other ones. So what are these common ones that are commonly seen cases? We could see the atrial septal defect, the ventricular septal defect, patent ductus arteriosus, pulmonary stenosis, tetralogy of Fallot, coarctation of the aorta. And now we'll be going on briefly to describe some of these congenital heart defects. First of all, we have the septal defect. What is the septal defect? The septal defect is the defect in the septum of the heart. So we know we have the atrial septum, we know we have the ventricular septum. If you are lost about this, you could go back to our first lecture where we discussed the heart, and you will be able to get more information about the septum and about the chambers of the heart, or any other information about the heart that we need. So yeah, septal defects, you could have the atrial septal defect or the ventricular septal defect. And what do we mean by septal defects? Basically, it's the presence of holes in between the two chambers of the heart. So either between the atrium or between the ventricles. And typically you will hear in the hospital a common term which they use to describe septal defects. You could hear they say a child has a hole in the heart, or they have a case of a hole in the heart. They basically mean that this person has a case of septal defect. So now what we have to ask is it in the atrium or is it in the ventricle? So if it is in the atrium, it will be atrial septal defect, and if it is in the ventricle, it will be the ventricular septal defect. And now we'll go on to speak about pulmonary stenosis. In the beginning, I spoke on the fact that pulmonary stenosis basically is narrowing of the valve or of the vessels that is being affected. So in case of pulmonary stenosis basically is stenosis of the pulmonary valve, whereby the valve is narrower than usual. Therefore, it creates difficulty for the blood to flow through the right chamber of the heart to the lungs. And then we have the transposition of the great arteries. In this case, it's just like a change in position between the two great arteries, which are the pulmonary and the aortic. And in this case, it could either be the great arteries or the vessels that are attached to them, which is the pulmonary or the aortic valves. So when this switch occurs, usually the aortic valve takes out blood from the left side, which is already oxygenated, to carry to the body, and the pulmonary carries oxygen poor blood to the lungs. But in this case, when they switch, they start receiving the opposite. So the aortic valve receives the oxygenated blood, while the pulmonary valve receives the oxygen rich blood and carries it to the body. So just imagine the body receiving oxygen poor blood just because the position of these valves have been switched. That is what occurs in the transposition of the great arteries. Also, we have coarctation of the aorta. In this case, is also almost like a stenosis, where we see that the aorta is narrower than it will usually be, and once it becomes narrow, it becomes difficult for the blood to easily pass through. And also we have patent ductus arteriosus, which is the failure of the ductus arteriosus to close after birth. Usually the ductus arteriosus is open for fetal circulation and it closes once the child is given birth to, but failure for this ductus arteriosus to close is what we know as the patent ductus arteriosus. And then we have also the case of underdeveloped heart, which is where the heart or part of it is not fully developed, and this reduces its ability to function. And this is where I will point us back to the classification we had on earlier on, where I spoke on the HLHS. Here with HLHS meaning hypoplastic left heart syndrome. What we have in this case is undeveloped left side of the heart. So this HLHS, which is the hypoplastic left heart syndrome, is a case of underdeveloped heart. Here it is underdeveloped left side of the heart. So the left side of the heart is not properly developed, and this reduces the function of that side of the heart. And also I will go on to explain truncus arteriosus, which is the first one under the mixed type of congenital heart defect. Under truncus arteriosus, what we see is that the blood vessels that are coming out of the heart in the developing baby fails to separate completely during development, leaving a connection between the aorta and the pulmonary artery. Remember how I said about transposition of arteries, how each of these vessels have the blood that they are carrying. But in case of truncus arteriosus, now they don't separate. Now it's not even swapping of position. They are not separated. So it's like both oxygen-rich blood and oxygen-poor blood are passing through the same vessels because there was no separation during development of this baby. So the blood is mixed, and mixed blood will go in to get oxygen. Mixed blood will also flow out of the lungs to the left side of the heart and into the body. So you can imagine what happens then. The body is also getting a bit of oxygen poor blood. And now we have the total anomalous pulmonary venous return, CAPVR. What happens here is that the oxygen-rich blood does not return from the lungs to the left atrium. Instead, the oxygen-rich blood returns to the right side of the heart and mixes with the oxygen-poor blood. And that is why we have the mixed form. So when the blood is oxygenated, it goes back to the right side and then mixes again with oxygen-poor blood and comes again to be reoxygenated by the lungs. So it's just like a repeating circle kind of. While the body is getting some blood, the bulk of it goes back to the right heart to get oxygenated all over again. I do hope you understand it to this point. So moving on. What do we have next?
Well, everyone, we've come to the end of today's lecture. We'll be having the second part of this lecture on our next video, so do well to look out for it. And if there are questions pertaining to this topic down to this point where we added today, do well to send us a DM or mention it in the comment section. Bye for now.